This video demonstrates the KIM maneuver for the treatment of horizontal cupulolithiasis BPPV, the Apogeotropic variant. Equipment required for this treatment is a vibration device, demonstrated in this video by a whiteboard marker. Once the examiner has acquired the vibration device and has it nearby, begin the patient in supine for 3 minutes. The examiner instructs the patient to lay on the affected side and rotates the patient's head 45 degrees towards the earth. Wait for nystagmus to subside. The physical therapist then applies vibration to the patient's downward-facing mastoid process for 20 seconds. Remove the vibration device and hold this position for 3 minutes. The patient stays sidelined on their affected side and rotates their head to a neutral position for 3 minutes. Change positions to lie the patient in supine with their head in a neutral position for 3 minutes. The examiner instructs the patient to lay on their unaffected side and maintains the patient's head in a neutral position and hold until nystagmus subsides. After the nystagmus has subsided, the physical therapist applies vibration to the patient's upward-facing mastoid process for 20 seconds. Remove vibration and hold this position for 3 minutes. The patient changes positions to lie prone with their head in a neutral position for 3 minutes. Complete the maneuver by returning the patient to an upright position.